Welcome back. My name is Janice Pizzonia, and I love learning about how the body works, especially how the body works to eliminate chronic disease. Now, in video number 1, we discussed how the body does this by removing waste from the cellular level using the lymphatic system. If you didn't get a chance yet to watch video number 1, go back and watch it. Now, the biggest takeaway from this first video was that if this waste isn't removed from our bodies, that it can cause inflammation and dehydration at a cellular level. And if this issue isn't addressed, it can cause a whole host of health issues that I call acidosis. So in today's video, I am going to show you how you can test at home for free, non-invasively, that your body is eliminating this waste the way that it should. One important thing to remember is that the waste that I'm talking about, everybody has it and everybody generates it every single day. Remember from video 1 when I told you about your body is 100 trillion cells and 2 fluids. Well, the 100 trillion cells is like having 100 trillion infant babies. They all require food multiple times during the day, and they'll all eliminate multiple times during the day. This is the waste that I'm talking about removing from the body and removing it on a regular basis so that it doesn't accumulate. This is called metabolic waste. We can have another video about the acidic waste that's generated from food that you eat and a lifestyle that you live. But for today, assume you have a perfect diet and assume you live a perfect lifestyle. We still have all this waste from these cells that we need to get rid of. In this video, we're going to learn about a test on how you can see if your body is getting rid of this metabolic waste. So this test will be testing your kidneys. It's your kidneys' job to remove the waste that comes from the lymphatic system out of your body via the urine. In addition to this test, you can also determine kidney weakness by your individual symptomology. Signs of a weak kidney would include bags under your eyes, especially first thing in the morning, vision problems, lower back pain or lower back weakness, kidney stones, urinary tract infections, incontinence, dehydration, edema or water retention, as well as headaches. It's always good to look at holistically at the whole picture. So we're always going to want to look at symptomology as well as any results from tests that we may be doing. This test is called the Kidney Filtration Test. And as the name implies, it tests the filtration ability or lack thereof of the kidneys. If your kidneys are working optimally, then you should see filtration or sediment within your urine. Sediment would include white flakes, mucus strands or mucus strings, and this is initially seen as cloudiness within the urine. But if you allow the urine to sit overnight in the refrigerator, it will settle to the bottom, kind of like a snow globe, and it's much easier to see the filtration at this point. It's very important to remember that healthy kidneys do not filter all the time. So you're not always going to see sediment in your urine. But healthy kidneys will filter about 80% of the time. Remember the 100 trillion cells and all the waste that they generate. You need to be eliminating that every day, otherwise it's going to accumulate. So we do want to see sediment in our urine about 80% of the time. But remember, if you drink a lot of water during the day, you will see clear urine, and that's perfectly fine. So how do we do this test? Well, first thing in the morning when you wake up, I want you to take a clean glass jar, such as a mason jar, and urinate in it. And we're going to look to see if you can see any type of cloudiness. I like to hold it up to the window and look through it. It's a little bit easier to see. And then we're just going to cover it, and we're going to put it in the refrigerator until the next morning. Now the next morning, we're going to take the jar out of the refrigerator and take a look at it. You'll either see one of two things. The urine will still be clear, which means your kidneys are not filtering, or you will see sediment at the bottom. This could show up as some like white powdery. It's kind of like the snow globe that hasn't been shaken yet, where all the snow is sitting at the bottom. It kind of looks like that. And I'm going to show you some pictures, so you're going to be able to have a reference of what I'm talking about. But if you do see the sediment, that means your kidneys are filtering, and then it is getting the waste out of your body. Then after taking a look at it, you can flush it down the toilet, clean the jar, and reuse it for the next day. And do this on a daily basis. Next, we're going to look at some pictures of what filtration may look like. It may look like this. And this is urine that was just put into the jar. And you want to look for, like I said, the cloudiness within the urine. It's great to hold it up to the window and look through the light to see if you can see anything floating or any specks or sediment floating within the urine. But after 24 hours of it sitting in the refrigerator, that same urine will look like this. And as you can see, the sediment now shows at the bottom. It settles to the bottom, so it's much easier to see if there is sediment, how much sediment there is, and what the sediment looks like. That's why I recommend that you actually put the urine in the refrigerator. But if it sits for 24 hours in the refrigerator and it's still clear, like we see here, don't worry about it. This is how I started. My urine was clear every time I checked, every single day for about 3 to 4 months while I was working on my body. And then one day it happened. Look at this picture. My kidneys started to filter, and I was super happy. I was getting the waste out of my body, and I was so excited. And then it stopped again. And there was a process that I went through where I would filter for several days or weeks, and then it would stop for months, and then it would start again. And it was a lot of on again, off again. So just remember that it's a process, and keep going. And as long as you keep going and keep with it, you will see, as I have now, I regularly filter, and it's great peace of mind to know that my kidneys are working, and they're working on getting out the waste. Yes, there's always room to improve and to get out more waste, but you have to jump that first hurdle and make sure the kidneys are able to do it. And from there, you can just improve upon them. And once you start filtering, you're going to see some variables within your filtration. Sometimes you may filter, sometimes you may not. The amount can vary, as well as what the sediment in the consistency of the sediment. You may see mucus strands or mucus strings. You may also see different colors within your filtration. This is a picture of some filtration that I had removed, and as you can see, there's an orangey reddish color to it, and that is from sulfur that I have accumulated within my body. And sulfur has that orangey reddish look to it, and as you can see, when it comes out, it has that same look. So that's how I knew it was sulfur being removed from my body. So it's very interesting to watch what happens, and you can understand what's happening in your body by analyzing or looking at the results of what's coming out. So I encourage you now to go ahead and get that clean glass jar, put it in the bathroom for tomorrow morning, or if you're super excited, you can do it right now. After you do this test, you may have one of two questions. So I'm filtering. What next? Or I'm not filtering. What next? Well, if you are filtering, congratulations. That's great. You are getting some of that waste out of your body. Now we can always step it up and increase the amount of waste that we're getting out. Like I said, there's 100 trillion cells, and there's a lot more waste when we talk about what we eat and our lifestyle, so you can always increase the amount of waste that you're getting out of the body. Now, what if you're not filtering? Well, I'm going to say great, congratulations again. Why? Because at least now we know what the root issue is, why your body's inflamed and why your body's dehydrated. It's because the waste, the acidic waste, is not getting removed from your body. So great, we know now what the issue is and we can start to address it. So stay tuned for my next video where we will talk about the tools and techniques that we can use to either improve the kidney filtration that you currently have or initiate it, get it starting. You need to understand what types of activities and food and diet is going to affect your kidney filtration so that you can get it ramped up and so we can get those wastes out of the body. So I look forward to seeing you there. Thank you.